Sir, are my slides visible?
Yes, your slides are visible. Please start.
Okay. Thank you, sir. Thank you so much. So to start my presentation, under the guidance of my mentor, Professor Abhijit Kaur ma'am and Dr. Nitika Pandey ma'am, we conducted a study in our tertiary care center based. It is a retrospective study to analyze the evolving trends in extraocular cysticercosis. So, what is cysticercosis? Cysticercosis is infestation of Cysticercus larva, which is spread through unhygienic practices and poor sanitation. The larva penetrate the intestinal wall and spread into various tissues and organs of our body. When it infests our eyes, it causes ocular and extraocular cysticercosis. With this background, we reviewed the literature. We found out that in 2000, David et al. The endemicity of the disease in India, along with the importance of sanitation and health awareness. In 2001, Puskar et al. Conducted a clinical study to sort the varied spectrum of ocular presentation of the disease. In 2004, Sundaram et al. Suggested the vital roles of ultrasonography and CT scan in the diagnosis of the disease, as well as the importance of commencement of medical therapy with albendazole under steroid cover. Next, in 2007, Madhiguba et al. Conducted a trend analysis study and showed us that the trend of intravitreal cysticercosis was increasing, while the trend of extraocular cysticercosis was decreasing. In 2010, Rath et al. Conducted a large retrospective observational series of 141 patients and reviewed the demographic, varied clinical profile, and the management outcome of their patients. In 2017, Dhiman et al. Published a review article emphasizing upon the health education, hygienic feeding practices, and the importance of accurate diagnosis with a high index of suspicion for timely management of patients with orbital cysticercosis. With this review of literature, along with our personal experience in the management of such patients, we aim to analyze the evolving trend of sociodemographics, clinical profile, and treatment outcome of extraocular cysticercosis over a 15-year period. We took 450 consecutive cases of extraocular cysticercosis from January 2004 to January 2019. We divide our study duration into 3 groups of 5 years each. The parameters that we analyzed were gender, age at presentation, presenting complaint, laterality, onset of presentation, location, previous treatment, any associated neurological involvement, dietary preferences, and socioeconomic statuses. The diagnosis of our patients were made either on CT scan with the characteristic CT scan finding of hypertension, central hypertension complex, or on serum ELISA, or on the histology of the excised cyst, or when the patient improved on medical therapy. The resolution of the patients was said when there is collapse of the cyst wall on CT scan with complete resolution of signs and symptoms within 3 months. The analysis were done using chi-square test for trend analysis. These were the highlights of the results from our study. We found an increase in the number of cases over 15 years period. Vegetarians predominate over non-vegetarians, and we saw more chronic presentation in group C, while most of the patients had acute presentation in group A. The LPS and superior rectus muscle complex were the most common site involved. In this table, we can see the increasing number of cases over the time period. The mean age of presentation seems to be within the adolescent age group. And we can see in group B and group C, the vegetarians predominating over the non-vegetarians. In this graph here, we can see the increasing trend of chronic presentation depicted by this gray line, while the acute presentation was decreasing over the time period. Similarly, in this graph, we can see the increasing trend of penless mass, proptosis, and strabismus, which are the signs and symptoms of chronic presentation, while the signs and symptoms of acute presentation, that are painful mass and congestion, decreasing, which again shows the chronicity of the disease. This is the same table depicted in the graph earlier. So with these results can finally be useful when something meaningful can be derived. So what are the references that we can make? We can say that with the advent of better radiological imaging, there is an increase in the diagnosed cases of extraocular, which we see throughout our study period. The predominance of the vegetarian over non-vegetarian emphasized the need for the patient education regarding the sanitation, hygiene, and feeding practices. The increase in the frequency of chronic disease might be due to misdiagnosed and incompletely treated cases. This leads to restrictive fibrosis in the due course and the chronic presentation, which we saw in the previous graphs. The reduced frequency of surgical intervention in recent years might be the result of this better diagnostic facilities that we had nowadays and the availability of the drug at the family center. The better follow-up visits that the patient had now in the recent past can be attributed to this improved communication and transportation facilities that we had. So all of these, with all of this,
Sorry to interrupt, sir. You need to conclude as your time is up. The last minute is for the discussion.
Yes. Okay, sir. So finally, we can conclude here that with higher prevalence, that in my study we had higher prevalence of the disease in younger age vegetarian population and low socioeconomic status, and we found that there is a shifting trend towards chronic presentation, which gives the importance of better diagnostic facilities, awareness of clinical profile, and timely management of the disease. Thank you for your time and patience.
We will take one
Ashutosh,
question.
if I should ask you just one question, what is the first symptom when the extraocular muscle is involved? And what percentage of these cases over 15 years required surgery?
When the first symptom that the patient had is a limitation in the movement, depending upon which muscles is involvement.
So what will be the symptom of the patient? Sign is the limitation of movement. What is the symptom?
Yeah, the symptom with the patient had the patient will come with symptoms of diplopia.
Diplopia. Very good. And what percentage of patients?
Sorry to
needed
interrupt, ma'am. We
surgery?
have to move on.